Dock the eye following the information of the Centraline Treatment Centering Assistant. Initiate the laser treatment by pressing the foot switch and start the manual surgery only after verification of the correct laser application. Gently open the incision over the entire width with the hook of the double-sided SMILE instrument. For this, insert the tip of the hook and open the incision without reaching to the lenticule edge. Please note that it is recommended to stabilize the eye with suitable forceps during the entire dissection procedure. With the same hook in the clearance area between the cap edge and the lenticule edge, create an entrance to the upper plane by pointing the tip of the hook slightly upwards and move it above the lenticule to the opposite side of the incision. This will create a pocket for the anterior plane. For creating the posterior pocket, point the hook slightly downwards to enter the lower plane at one end of the incision. Wiggle the hook while entering the posterior plane slightly. Carefully observe the tip of the instrument's hook. If gas bubbles and the lenticule edge are visible above the instrument, the posterior pocket is successfully created. Extend this opening to be big enough for the SMILE dissector. Turn the instrument around to the SMILE separator and move it into that end of the incision which has no posterior pocket. Point the tip of the separator slightly upwards when reaching the lenticule edge. While entering this anterior plane, no gas bubbles and no lenticule edge should be visible above the instrument. Carefully dissect the complete anterior plane with circular movements and without stretching of the cap. For dissecting the posterior plane, enter the separator into the created pocket. The lenticule edge and the gas bubble layer should now be visible above the instrument. Do a careful straight dissection over the pupillary area to the inferior side. Resistance during the dissection confirms that the separator is now in the posterior plane. Further extend the dissected area from the center while leaving an anchor point on one side. This temporal or nasal anchor point prevents the lenticule from uncontrolled folding and rolling. Dissect the lenticule anchor point as last step. Extract the lenticule only after completed dissection of both planes. Do not stress the incision with the forceps when attempting to grasp the lenticule. Remove the lenticule slowly by observing the lenticule edge. This helps to verify the correct round shape of the lenticule during removal. Optionally check the lenticule for completeness by unfolding the lenticule on top of the cornea. At the end, make sure that the corneal surface is smooth and the incision gutter is closed.